Write the drug treatment of peptic ulcer disease. So, the drug for peptic ulcer disease are classified into two types. The first category reduce the gastric acid secretion, and the second category will neutralize the gastric acid. That is, they are known as antacids. The two broad categories: first, that will reduce gastric acid secretion, and second, that will neutralize gastric acid, which are known as antacids. So, H2 antihistamines, proton pump inhibitors, anticholinergic drugs, prostaglandin analogs. So, these reduce gastric acid secretion. H2 antihistamines, proton pump inhibitors, anticholinergic drugs, and prostaglandin analogs. So, the mnemonic can be HPCP. H for antihistaminics, P for proton pump inhibitors, C for anticholinergic, and then P for prostaglandin analogs. There are two P's: proton pump inhibitors and prostaglandin analogs. They reduce gastric acid secretion, and also two anti things, that is antihistaminics and anticholinergics. See examples of antihistamines: cimetidine, ranitidine, famotidine, and roxetidine. So these antihistamines, they end with the word tidine: cimetidine, ranitidine, famotidine, and roxetidine. Cimetidine, ranitidine, famotidine, and roxetidine. So cimetidine, ranitidine, famotidine, and roxetidine. These are example of H2 antihistamines. There are two R, one is ranitidine and then roxetidine, and then CF, that is cimetidine and famotidine. So it's CFR or R2CF, RCF, R for ranitidine and roxetidine, C for cimetidine, and F for famotidine. Then the second category was proton pump inhibitors. In proton pump inhibitors, we have the drugs that will end with the word prazole, like omeprazole, esomeprazole, lansoprazole, pantoprazole, rabeprazole, and dexrabeprazole. So these drugs end with the word prazole. Proton pump inhibitors end with the word prazole, like omeprazole, esomeprazole, lansoprazole, pantoprazole, rabeprazole, and dexrabeprazole. So there's omeprazole, esomeprazole, rabeprazole, dexrabeprazole. So omeprazole के आगे we add S, rabeprazole के आगे we add dex. Then lansoprazole and pantoprazole. Pantoprazole, so it's commonly used. So example of proton pump inhibitors: omeprazole, esomeprazole, rabeprazole, dexrabeprazole, pantoprazole, and lansoprazole. Then the third category was anticholinergic drugs, in which we have pyrenzipine, propanthelene, and oxyphenonium. So pyrenzipine, propanthelene, and oxyphenonium, these are example of anticholinergic drugs. So there are two P's, pyrenzipine and propanthelene, and one O, that is oxyphenonium. So example of anticholinergic is OP या PTO. There are two P, that is pyrenzipine and propanthelene and oxyphenonium. Pyrenzipine, propanthelene, oxyphenonium, and prostaglandin analog example misoprostol. So these are the drugs that will reduce gastric acid secretion. H2 antihistamines, they end with the word tidine. Examples are ranitidine, roxetidine, cimetidine, and famotidine. So H2 antihistamines, example ranitidine, roxetidine, cimetidine, and famotidine. Proton pump inhibitors will end with the word omeprazole, like prazole, like omeprazole, esomeprazole, rabeprazole, dexrabeprazole, then pantoprazole, and lansoprazole. So So proton pump inhibitors are omeprazole, esomeprazole, lansoprazole, pantoprazole, rabeprazole, and dexrabeprazole. In anticholinergic drugs, we have pyrizinamide, propanthelene, and oxyphenonium. Prostaglandin analog example, misoprostol. Then neutralization of the gastric acid, which are known as antacids. So antacids में further categories are systemic, non-systemic, ulcer protectives, and anti-H. pylori drug. So systemic antacids are sodium bicarbonate and sodium citrate. These sodium salts are systemic antacids. Sodium bicarbonate and sodium citrate, these are systemic drugs that will act on the systemic system. And then the non-systemic drugs, that is magnesium hydroxide, magnesium trisilicate, aluminium hydroxide gel, calcium carbonate, and magalrate. So example of non-systemic magnesium salts like magnesium hydroxide, then magnesium trisilicate, and also aluminium hydroxide gel and magalrate and calcium carbonate. So magnesium hydroxide, magnesium trisilicate, aluminium hydroxide gel, magalrate, and calcium carbonate. These are example of non-systemic magnesium salts like magnesium hydroxide, magnesium trisilicate, then aluminium hydroxide gel, calcium salts, and magalrate. Magalrate, it is a non-systemic antacids. Then we have ulcer protectives. Ulcer protectives mein there are two things. One is sucral faith and CBS, that is colloidal bismuth substrate. Sucral faith and colloidal bismuth substrate, these are ulcer protectives. Then anti-H. pylori anti-H. pylori drugs, these are amoxicillin, clarithromycin, metronidazole, tinidazole, and tetracycline. So H. pylori drugs are amoxicillin, clarithromycin, metronidazole, tinidazole, tetracycline. Amoxicillin, clarithromycin, metronidazole, one more dazole, that is tinidazole, and tetracycline. So ampicillin, clarithromycin, metronidazole, tinidazole, and tetracycline. Amoxicillin, clarithromycin, metronidazole, tinidazole, and tetracyclines. These are example of anti-H. pylori drugs.